What if someone told you that you needed to pull out perfectly healthy teeth just to make a profit? That's exactly the question a recent CBS News investigation is asking. Are corporate dental chains pressuring patients into treatments they don't really need? Hey everyone, I'm Dr. Daniel Choi, a board-certified periodontist since 2011 at North Texas Dental Surgery. I place tens of thousands of implants, including full-arch solutions like All-on-4, and today I'm dissecting this CBS report that's raising alarms about healthy teeth being removed for the sake of profit. Here's what we'll cover: the real story behind the trend of removing good teeth, the role of high-pressure sales tactics in certain corporate dental chains, red flags you should be aware of before committing to implant surgery, and 5 key questions to ask any dentist or implant center. By the end of this video, you'll be armed with the critical information you need to protect yourself from unnecessary treatments. I've also linked the original CBS article in the description below. Definitely check it out if you want to dive deeper. Now, before we dive in, I've created a free PDF summary that covers everything you need to know, from red flags to watch out for to the key questions to ask any All-on-4 provider. You can get your copy by submitting your email in the link below, and I'll send it right to your inbox. So let's get to the story. There's a patient named Becky Carroll who was missing a few teeth and others were stained or crooked. Her dentist offered to fix most of her teeth with root canals and crowns, but she was wary of traveling a long road of dental work. Then she saw a commercial for an unnamed dental implant center, and Carroll agreed to pay $31,000 to replace all her natural upper teeth with prosthetic ones. Imagine you're frustrated with stained, missing, or crooked teeth. You see a slick commercial promising a fast and comprehensive solution, and you think, this could change my life. Well, that was Becky Carroll's situation, and she ended up replacing all her upper teeth for $31,000. Now, her story underscores the importance of informed consent, knowing every option before signing on the dotted line. She had alternatives like crowns, veneers, or braces, but they can be time-consuming and costly. For middle-aged patients who crave a uniform, predictable, and aesthetic solution like All-on-4, it can be undeniably appealing. But does it always make sense to remove good teeth? Let's talk about that. So why would removing good teeth sometimes make sense? Well, imagine a house with a failing foundation, rotting walls, and a leaky roof. You can patch up a few spots, but the overall structure won't hold up long term. Sometimes you have to tear it down and start fresh. In dental terms, if you have multiple failing teeth, periodontal disease, or significant bone loss, holding on to a couple of okay teeth might jeopardize the stability of your new arch. All-on-4 can offer a stable, functional, and aesthetically pleasing result, if done correctly. That's why some dentists remove a few salvageable teeth. They're looking at the big picture of your oral health and final outcome. So what are the benefits of starting fresh with All-on-4? Well, number 1, you get unified aesthetics. A single arch built from the ground up creates a harmonious, natural-looking smile, especially important for those who prioritize appearance. Number 2, structural stability. Removing weak or failing teeth gives you a stable foundation for the implants, reducing the risk of ongoing infections or complications. Number 3, predictability. Instead of endless procedures, gum surgeries, root canals, restorations, All-on-4 provides a clear path to a healthier, more confident smile. That said, All-on-4 is only as good as the dentist or specialist who performs it. Poor surgical technique can lead to failed implants and irreversible bone loss. That's why I'm passionate about educating patients. Your health is on the line. So let's go back to this article. Fred Goldberg, a Maryland dental malpractice attorney, said, "Every client I've had who has gone to has started a meeting with a salesperson. They agree to financing before they even meet the dentist." Think about it. You're sitting in a fancy consultation room and someone with no dental background is telling you what you need and asking you to sign a financial agreement before a dentist even looks in your mouth. That's a huge red flag. Now, why is that an issue? Well, number 1, there's sales before diagnosis. Only a qualified dentist should diagnose and develop a treatment plan after reviewing your scans, x-rays, and medical health history. And then number 2, that's high-pressure sales tactics. People often feel locked in financially and emotionally once they sign up. At my practice, treatment coordinators help with scheduling and communication, but I handle the diagnosis and plan. It's that simple. To protect yourself, arm yourself with these 5 crucial questions. Number 1, will I meet the dentist or surgeon first? If you're pressured into financing before meeting the dentist, walk away. Number 2, ask what are your alternatives. A reputable center will discuss crowns, root canals, partial dentures, whatever might fit your situation. Now, it might not be the right solution for you, but they should at least go over all your options. Number 3, what is the dentist's experience with this procedure? Find out how often they perform all-on-4 or full arch cases and if they've handled complexities like yours. Number 4, what follow-up care is included? Make sure any quoted price includes maintenance, repairs, or necessary adjustments. And number 5, what are the risks of this procedure? Implants can fail, and peri-implantitis is real. You deserve a full disclosure. All-on-4 can transform lives, but it's not a one-size-fits-all. If your teeth are still salvageable, you might do better with a more conservative approach. So who would benefit from all-on-4? Well, number 1, people with advanced periodontal disease. If your teeth are truly failing, all-on-4 might be the best long-term fix. Other peoples with severe aesthetic concerns, well, if you can't live with your teeth's appearance, a full arch solution might restore both form and function. And for other people who have cost and time constraints, many patients who haven't been in the dentist in years want a faster, predictable outcome. Just make sure that you seek an experienced dentist or specialist who can give you a thorough evaluation because your situation is unique. Now let's go back to the article. When full arch implants fail, patients sometimes don't have enough jawbone left to anchor another set. If those fail, you don't have anywhere else to go. So this is the nightmare scenario. Failed implants can lead to catastrophic bone loss, so severe that you might need zygomatic implants, which are drilled into the cheekbone, to have another chance. That's why careful planning and expert execution are critical at my practice. We focus on over-engineering cases, using better materials, doing robust planning, and a surgical approach that sets you up for long-term success. Back to the article. Private equity firms have spent billions buying large dental chains. The concern is overtreatment and focusing on short-term profits over patient care. Private equity has undeniably changed the game. While increased efficiency can benefit patients, it also raises concerns about cost-cutting, staff quality, and pressures to dentists to hit revenue targets. For complex procedures as complex as all-on-4, it's best to consult with specialists, periodontists, prosthodontists, or oral surgeons who understand the nuances of full arch reconstruction. And back to the article. Many patients believe a fallacy that implants are bulletproof. In many instances, they need more care than teeth because they are not teeth. Implants are not maintenance-free. They can't get cavities, but they can develop peri-implantitis, leading to serious complications if neglected. Good oral hygiene, regular checkups, and the understanding that future maintenance might be needed are all part of the deal. If any provider tells you implants are forever or problem-proof, consider that a big warning sign. Before you commit to any major dental procedure, especially something as life-changing as all-on-4, do your homework, ask the tough questions, read the fine print, and make sure you've consulted with a specialist you trust. If you want to discuss your specific case, feel free to reach out to us at North Texas Dental Surgery. And if this video helped clear things up, please like, subscribe, and share it with someone you know who might be facing a big dental decision. Thanks for watching. I'm Dr. Daniel Choi. Stay informed, stay proactive, and I'll see you in the next video.